that, let's talk about the contraindications, okay? These are gonna be the same for all radio frequency-based devices. So the first one's gonna be pregnancy, we talked about this already.
Right.
6 months postpartum, 3 months post-breastfeeding.
6 months postpartum,
Yes,
and 3 months post-breastfeeding.
yes.
Just talk about real quick.
She's a boss.
We just started talking about contraindications.
Okay, we'll talk about
Yeah.
this.
Good, alright, so any skin disease in the treatment area, you don't wanna treat over active, like lesions, right? So if like somebody had eczema, psoriasis, say they have scrape, I'm not gonna treat over anything like that, okay? If anyone has any, tattoos in the area, including permanent makeup, and what I mean by that is, you can totally treat like somebody's face if they have their eyebrows done.
Right.
You just cannot directly go over the eyebrow with the radio frequency. If somebody has lip blushing done, you can't directly go over the lips with radio frequency. If somebody has like a little tattoo here, you can go right up next to it, but you just can't go over it.
What happens if you go over it?
Great question. So there's no FDA regulations for tattoos, so unfortunately there could potentially be metal in there. If there's metal in there, then what's gonna happen, it's gonna absorb the heat from the radio frequency, now we run into a burn.
Oh, okay.
So we're not sure if there's metal or not,
Because
but we
it's
have to
the
be safe.
FDA regulations against this permanent makeup.
Yeah, right, exactly.
Alright.
Some of them are metallic based and they say that, some tell you they're not, but who really knows? So we
Right.
just wanna be safe for our patients. And just to piggyback off of that, hip replacements or other metallic devices. So it's the same as like a grounding pad, like if you're cauterizing something, like you need a grounding pad, cause that energy needs to go somewhere. We don't want that energy to accidentally go to a metal hip replacement or a titanium plate in the face. Dental implants are totally fine, that's a small amount, you know, just put gauze in the mouth, that's fine. But if someone told me they had a titanium plate, I wouldn't be treating them for their face. If somebody had a hip replacement and I was treating the face, fine, okay, that's far enough away. I like to use like a 1 foot rule, but other than that, like you don't wanna be treating in the area that that metallic device is, okay? In regards to pacemakers, defibrillators, any electronic implanted devices, that's a no-no. We don't want to, you know, mess up that whole,
Frequency,
We
yeah.
don't want to speed up their pacemaker or, you know, slow it down or turn it off, yeah. So you want to be very careful.
Oh my God.
Yeah, we just don't want to do any of that. So don't mess around with that. Any blood coagulopathy or excessive bleeding or bruising, use of blood thinning medications. So typically, like, we'll say, like, if somebody's on like 81 milligrams of aspirin, you know, maybe wait like a week and then they can go on it. Make sure that it's clear, you know, that there's not like a reason, like it's recommended they have to be on this, like Coumadin, warfarin, things like that. Lovenox, you wanna be very careful. If they're supposed to be on it, there's probably a reason, and we don't want them just to go off of it just because they're doing this treatment. So when in doubt, refer it out, make sure you have a doctor's note just saying that they're cleared and that they can still have treatments. They can stop this medication in advance prior to doing treatment.